My friends, the hard truth is, right now, today, there's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain. Thousands of lives are at stake. And the actions we take today, what we do as a government and as a people, today will determine what we face tomorrow. And these next 2 weeks will be absolutely critical because we know a surge is coming.
A serious warning today from Ontario Premier Doug Ford. Ontario could be the next COVID-19 epicenter like Italy and Spain. Toronto's Medical Officer of Health, Dr. Eileen de Villa, doubled down on that warning. She believes Toronto may be facing what New York City is battling. Toronto issued mandatory isolation orders today in an effort to keep that from happening. Toronto's Mayor John Tory joins us from that city. Hi, Mayor Tory. Thanks for making time for us.
Fine, Becky. Thank you very much.
Can I start off by asking you about that statement from Dr. de Villa, specifically the idea that there is cause for concern right now? Tell me a bit about the genesis of that and where your concern particularly lies.
Well, I asked her on the weekend to make a presentation to the senior people leading our efforts to deal with this health emergency. And when we had that presentation, together with a prescription that she suggested, largely what she announced today, I felt there was absolutely no alternative but to support her completely in moving forward to essentially do anything that a local government could do to, lock the city down. And because we are on a trend line to be in the same kind of situation as New York, but there is a way in which we can stop that. We can reduce the number of deaths. We can protect the healthcare system. We can protect the damage done to the economy and get ourselves out of this faster, get our lives back faster. And so it's now up to people in Toronto to follow what Dr. de Villa has said. And I think that it's time to rally around and it's time to get a win here against this virus that is just deadly, as Premier Ford said.
I want to get into those specific measures that you announced today in a second, but just on those sort of predictions, I think everybody is inundated with the news right now, right? They're watching the story unfold in New York, and it is at times horrifying, right? And we know, I guess, the comparison in and of itself. What was the message that was, that she and you are trying to drive home by invoking that comparison?
That 3 weeks ago in New York, there were no deaths. And today, I haven't seen the updated numbers, but it's 1,200 or more. And that we can go that direction, which nobody wants to do, with terrible loss of life and with terrible damage that may go on for a long time, and with really terrible damage as we see in New York, where the healthcare system is under such stress they're building hospitals in parking lots. We can do that. Or we can change that course by deciding before that surge comes, as Premier Ford said, that we're going to take action, most of it being action we take on our own. Yes, we can issue orders and I can issue orders and we can all make speeches. But in the end, people have to decide. They're going to change their behavior. They're going to stay home. They're going to go out once a week if they can possibly keep it down to that, which most people can. That we're going to take particular care of older citizens who are more vulnerable. We're going to, really tighten up even further our procedures in the long-term care facilities where a lot of vulnerable seniors live, and so on. And these are things mostly that rest with individual Torontonians and individual Canadians, because this is not a problem that is confined to Toronto. The projections across the country are that we could see things get much worse before they get better, but we have a chance to change that starting now.
In addition to what individuals can do, your government, the city did take some extra measures today, particularly where mandatory isolation orders are concerned. Can you explain for our viewers watching right now what exactly that means?
Well, for example, if somebody is diagnosed as having COVID-19, then they will be the subject of, and they are the subject now of an order that says they are to be isolated, because there are people, believe it or not, who might have this virus and have been diagnosed as such who are still out and about. And so this will allow for individual orders, and it has really issued in effect a blanket order to say if you have COVID-19, then you stay self-isolated, period, full stop. It has said, for example, when it comes to long-term care homes, where tragically we've lost more people today because of the circumstances there with all elderly, vulnerable people and with people in close quarters, that staff can't work in more than one place, that visitors only in the ultimate, period of compassion where somebody's at the end of their life, visitors just aren't going to be able to come to those places. And that is the kind of thing we're having to do to tighten this down, in addition to saying to people, stay home, only shop once a week. It's difficult for us to enforce that, but that is what we're saying to people. Stay home. Do not, gather in crowds anywhere. We already have a provincial order in place saying no groups of 5 or more. And people have to start following this, though. We have scenes in Toronto today. People hopping over fences of places we put up fences to close down by way of recreational facilities. I do not get what these are adults. These are not 4-year-old children, and they're adults who know we're in a human healthcare emergency here, and they're still doing this. So I hope these series of orders will help us to get the message across, together with some fines and other kinds of enforcement if necessary.
You sound frustrated.
Well, I am, because these are adults, and these are people who don't understand. I think they somehow think Canada or Toronto or other cities in Canada are immune from this. They're not. We're in a different place in time than some of the places where we've seen unspeakable tragedy, including in New York, which in the case of Toronto is an hour away from us. And out west, they've seen it in Seattle, which is an hour away. And I don't know why we think that if we don't behave differently, we're going to have any different a result. And we don't want that result. We don't want the needless loss of life. People like me and the medical officer of health are put in the offices we hold to stop needless loss of life, to protect the healthcare system, to protect the economy and the way of life that we have. And we're saying that we can't do this alone. We need people to decide it's time for us to take this on, and that we're going to do it collectively, and that our ability to do it collectively is going to determine whether we're here months from now still having the same experience, or whether we can get this, break the back of this thing in a matter of weeks. We've said 12 weeks.
You mentioned people diagnosed, and that's where the isolation order applies. Do you know of actual cases of people who are diagnosed who have been out?
I can't name one to you, but obviously the medical officer of health is doing this as a means of saying from now on. And that's why we really toughened things up today on a number of fronts, because we just said, and my reaction to the presentation that I had from the medical officer of health on the weekend was to say, anything that you suggest that is reasonable and practical, and we asked a number of questions and spent time in the last 2 days getting ready to implement these things, any measure that is going to stop that kind of loss of life, that is going to stop that kind of spread, is something that we should be doing. And you just do it. I mean, and these are things that are sometimes difficult to do, cutting down on the number of so-called essential businesses that are open. There are too many of them, and we've got to cut that list down. Sure, grocery stores, sure, pharmacies, and a few others, but by and large, we're just going to have more businesses closed. I hate to say it because it puts people out of work, but in the end, I'd rather have people that are going to get some help from the federal government being out of work for a while than have people who've lost their lives in large numbers.
On that list, Mayor, I know we spoke about it last time, but obviously a bit of time has passed, and I saw that the leader of the NDP wrote to the Premier asking him to reconsider where construction sites are concerned. I know that you're in close contact with the provincial government about that list. Where do you sit on those construction sites? Do you think now, has the advice changed, I guess, from public health officials? Should they be part of the non-essential businesses?
Well, I think we all agree that ones that are, say, involved building hospitals should be allowed to continue. Mm-hmm. I think that where you get into a gray zone is some of the ones where it is safe and has been deemed to be safe for people to work because they're not working, as they say, shoulder to shoulder. They have proper hand washing and all that kind of thing. But, my view is changing a little bit on this, in that I think part of the problem is, of course, people see the construction workers out doing the job even on a safe site and think, well, I'm supposed to be at home. I'm being told by the mayor and the medical officer of health to be at home, and I see these other people working. So I'm certainly more of the view now that while you absolutely have to let the hospitals and other kinds of really essential infrastructure projects proceed, that maybe we should take a pause on some of the others so that we can really say, as much as it's going to put those people as well in a difficult position in terms of their employment, that we're going to break the back of this thing. This is a disaster, and it is something that could become a worse disaster, as we've seen. If we let it. And I think that, unfortunately, some very strong medicine is needed here to get us out of this trend line that we're on in Toronto and other parts of the country, and get us onto a path that has us getting our lives back, stopping needless death, and protecting our healthcare system, which is going to be already under huge strain.
Okay, I'll leave it there, Mayor. Really appreciate your time this evening. Thank you.
Thank you very much.